Great. So I'm just going to give a brief little introduction and then Mike is going to take it away. So hi everyone. Thank you again for attending tonight's presentation, Medicare Workshop. My name's Najia. I'm a librarian with the Adult Programming Department at the Woodbridge Public Library. If you have any questions, feel free to send them to me in the chat. I'm listed as WPL librarian. So just to let you know the setup of tonight's program, I'm going to turn everyone's cameras off, or if you could turn off your camera, we're going to have all the cameras off so that everyone can focus on the presentation, and your mics are going to be muted to help with sound quality. If you have any comments or questions throughout the presentation, feel free to drop them in the chat. Try to keep them broad, nothing too specific, because you don't want to share too much information with strangers. So, but if we keep also to a smaller group, you might be able to come off of mute to ask your question and then go back on mute, but that'll be all at the end of the presentation. And just to let you know about our upcoming events, if you enjoyed tonight's presentation, which you definitely will, please feel free to check out our upcoming events on our Facebook, Instagram, Twitter, or website, woodbridgelibrary.org. And now please join me in welcoming Medicare Supplement and Advantage Specialist, Michael Salum.
Hi, folks. Thank you very much for attending today. I mean, it is a beautiful weather out there, but we do need to look into some of this Medicare stuff because it is very important to us at some point in time. I am a consultant. I'm an advisor. I speak Spanish, as you can see. On my own business, although I have been working for someone else I had been working for someone else for quite a while, but I decided to go off on my own. I have been, hold on one second. Oh, here we are. Who I am, I was in the corporate world for 35 years in corporate America. I was a floor manager with the New York Stock Exchange for 27 of those years. And I have managed some clerical staff. About 4 years ago, I went into, after I got laid off in the Wall Street world, I found a niche in this Medicare planning business, and I really, truly enjoy it. And I found that a lot of people don't realize, or, it's just overwhelming to them of what the situation is. I do take time with folks to teach. Basically, is what I do is I teach, I inform, I let you know exactly what your options are, and then you can decide on what you'd like to do. I don't, just as an FYI, I do not charge anything for my fees. As far as fees goes, I am commission based, okay? And as I mentioned, I educate by offering right now my free workshops. Just teaching about Medicare, and again, as I said, I provide options with whichever insurer that you might want to deal with, whether it's Aetna, Cigna, Mutual of Omaha, whoever it is, United Healthcare, whoever it is. And then I will also assist in enrollment with the Part A, the Part B of Medicare, any Medigap plans that go along with original Medicare, Medicare Advantage plans. And then the Part D, which is really the most difficult portion of all, is that Part D plan. And we will get into that in depth later on. Again, let me go back real quick. Again, I am not affiliated with any government agencies. I do not work for CMS, or I don't work for Medicare or Social Security. I am my own broker. I deal only with the A-rated companies in the United States, okay, and I assist folks in enrollment. But more importantly, I like to educate folks in Medicare, okay, and that's a critical movement. Medicare is really not difficult. It's basically only two avenues that you can go, okay. So anyway, without further ado, let's get started. Section 1 of we're going to be dealing with is going to be Medicare and Medicare supplements. Section 2 is going to be Medicare Part D with prescription plans. And then the Section 3, I'm just going to briefly go over everything that we've done. It's the top 5 mistakes that people actually make with Medicare. And you'll see the numberings on some of the slides. Okay, it's not going to be in order, but you'll see how it works out. Okay, so now let's get into the parts of Medicare. Parts of Medicare. Part A, which is called Original Medicare. You have Part A, which is your hospital insurance. With the hospital insurance of Part A, it deals with inpatient care in the hospitals, any skilled nursing facilities, any hospice, or any home health care. Okay. Anything, let's just say that anything associated with inside the hospital will be covered under your Part A. Okay. Now, normally there's no premiums involved with your Part A of Medicare. If you've worked in the country, if you pay taxes into Social Security or Medicare for 10 years or 40 quarters, then you will get your hospital Part A for free. If in some cases, people that have not worked at 40 quarters, then in order to get Medicare, you can purchase it on the side, but you're looking at about $450, $460 roughly in that ballpark for the Part A. Now, Part B of Medicare, that's your medical insurance. So now, as Part A was everything inside the hospital, Part A is going to be everything outside of the hospital. So any kind of doctor's care, any kind of in a hospital outpatient care, any kind of testing that the doctor might send, whether it send you to a CT, blood work, whatever the case is, any preventive services, durable medical equipment, for instance, anything that has to do with diabetes or maybe a walker or a wheelchair, things like that, that will be covered under Part B of Medicare. Okay. Now, Part B of Medicare, as Part A is you don't pay for it if you work your 40 quarters. Part B is income adjusted. It is IRMA adjusted, and it goes under. I'll show you that in a second. Now, most usually you're paying $148.50 a month, and I will go over shortly the scales or the tiers depending on the earnings for the year. Okay, but it is income adjusted. Now, if you are collecting your Social Security and you decide to go and you get Medicare Part A and Part B, and you become Medicare eligible at age 65 on your birth month, then you will be automatically enrolled in your Social Security. Now, if you're collecting Social Security, that $148.50 will be automatically deducted from your Social Security benefit. Okay, if you choose to collect Medicare and not collect Social Security, your Social Security benefit, then Medicare will bill you quarterly for the Part B premiums. Okay. Now, I'm going to skip Part C. I'm going to get back to that in a second. And we're going to go to Part D because synonymously, Part A, Part B, and Part D work together. Okay. Part D is the prescription drug coverage. All right. The plans. What this does is it helps you cover any kind of prescription costs that are associated with it with Medicare. They normally are privatized, so it's run by individual insurance companies, and they do have to have, since it is a state and federally regulated program, they do have to abide by certain rules. Okay, but after that, the way they want to tier the medications and the way they want to tier the certain aspects of what they offer, that could be up to them. But I will go over what they do need to be specific about, and every plan has to be the same exact way, no matter which insurer is going to give that plan to you. Now, generally, the Part D plans is about 35 different plans within the state. Each state has about anywhere from 30 to 35 plans. So, it's a critical, Part D for me is one of the most critical assessments that you'd have to do, and you'd have to do it on a yearly basis. It's usually, you do have to pay for your Part D premiums. It's a plan premium, and it also goes with your IRMA, okay, your MAGI for your taxes, your modified adjusted gross income. And I will go over that slide also as far as how much the planning is. But yes, it is usually it's it's a premium. There is a premium to that. And as I mentioned, Part A, Part B, and Part D do go together. Now, Part C of Medicare, it's a bit of a misnomer because Part C or Medicare Advantage plan, it literally takes the place of original Medicare A, B, and D. Okay. Again, it's a privatized program. If you're familiar with an HMO or a PPO, these plans actually, that's exactly what it is. HMO, PPO. You do have to go and abide by their doctors, their their hospitals, okay? Whereas original Medicare, A, B, and D, you can go to any hospital or any doctor in the United States that will take Medicare, that will take, that basically will take Medicare. Now, 98% of the hospitals in the United States take Medicare. 95% of the doctors also take Medicare. Whereas with a Medicare Advantage plan, if you wanted to go into another area, that's a possibility that you might not, you're not going to get coverage. Okay, so if you go into an emergency room, they'll take care of you right then and there, and then they'll send you to your coverage zone. Sometimes some of these Medicare Advantage plans are county-wide, depending on the plan itself. Sometimes they could be statewide. There are a couple of companies out there that do have a nationwide network. So I would prefer, if somebody wanted to take a Medicare Advantage plan, I would steer them toward a network like that. So if you live here in Jersey, but you're vacationing down in Florida, you can find a doctor, God forbid, if something happens while you're on vacation. Okay. Is there a cost associated with Medicare Advantage plans? Sometimes yes, sometimes no. For the most part, they are zero premium on those plans, okay? But the pricing does vary by plan. It all depends. PPO, generally, you do have to pay. Now, let's get into the pricing area of the plans, just so you get an idea. Now, this is what it's called, the IRMA, or the Income-Related Monthly Adjustment Amounts, okay? The way these plans are figured out, your earnings, okay, or your MAGI, which is your modified adjusted gross income. Now, you have your adjusted gross income on your taxes, and then there's a certain, which is just certain aspects of whatever you're paying goes into the adjusted gross income. Then the modified adjusted gross income, there's certain other things that you would have to pay for goes back in there, whether it's child support, alimony, blah, blah, blah. I'm not a tax guy, so please, that's like out of my realm. But that's how it basically works. Now, the way that works for 2021, okay, is they go, since 2020 is basically not on file yet, so they will go 2 years behind on your income taxes, okay? So your premiums for 2021, for your Part B premiums for 2021, it's gonna go through the 2019 taxing, okay? Now, as you can see here, you got Tier 1. If you're an individual filing single and you earned under $88,000, your monthly premium for your Part B is going to be $148.50. If you file joint, husband and wife or spouse, you're earning under $176,000, then you will have the same $148.50. And as you can see, if you're Tier 2, so from $88,001 all the way up to $111,000, or filing joint at $176,001 up to $222,000, your monthly premium for your Part B is going to be $207.90. Okay. Tier 3, as you can see, $111,001 to $138, and $222,001 to $276,000. You're looking at $297. And as you can see, Tier 4, 5, and 6 down the line, that's what your monthly premium is going to be. Okay. If there's one thing that I really stress folks about, is the following comment that I'm going to make, and please take note of this. Okay, we worked, we had our, we were earning excellent money at some point, but now you're going to retire. And you're not going to be earning that same amount of money because you're not going to be working. So, from $110,000, you're going to be looking at something that's going to be a lot less money. Okay, so what happens? Do you have to pay your $207.90 because that's what you earned two years prior? Yes, but Medicare is going to send you a letter. Okay, you have a 60-day window in order to appeal that letter. Okay, whereas you're going to call Medicare. Now, I suggest we do two things all the time. One, you call Medicare and let them know that you're going to send an appeal, because your modified adjusted gross income, when you speak to your tax guy, that modified adjusted gross income, even though you earned $200,000 in 2019, but now it's only going to be, let's say, $50,000. So now instead of paying that, $297 for that Part B, it's going to be reduced to $148.50. All right. As I'm saying, call up Medicare, let them know what your MAGA is going to be, your projected MAGA is going to be for the next year. And then also fill out the form and send that. And the reason I say do the two things, because with the mail, if it gets lost in the mail and you're past that 60-day window, you're out of luck. You're going to wind up spending the $300 a month for that Part B premium. Okay. So be leery of that. You do have, if you're going to be, you were earning good money, you're not going to be earning that any longer because now you are retired. So do you have to pay the $300, $297? No, you do not. You do have to, you have a 60-day window to appeal, and they will do it. They will grant you exactly what you tell them you're going to be earning. And believe you me, if it goes over, they're going to want to get their money also. So it's a good thing to know that you do have an appeal. There is an appeal process once we retire, and we're not going to be earning as much as we had currently earned. Okay. As I mentioned before, the Part D also, it basically works the same way. The Part D premiums, most Part D plans have they have their own premiums on their own. Remember, it's a privatized product. Okay, so now if you go into let's say for instance SilverScript right now, so there's a SilverScript RX plan for $7.30. Okay, there's other plans out there like let's say for a blue plan for $100 a month. Okay, so how does the tiering work, or how does the IRMA work for the Part D premium? If again it's the same formula as far as the money goes, your earnings went for 2019, but if you look at the let's say with tier 1, okay, it's whatever the plan premium is. If you're under the 88,000 or under the 176,000, it's whatever that premium is. So it could be $7.30, and that's what you're going to be paying. But once you start getting into the higher premiums, the $88,000 or the $176,000, or I should say the higher tiers, now you're looking at the $70.30 plus $12.30. Okay, or in tier 3, it'll be $7.30 plus $31.80, and so on down the line. Again, you can appeal this also, okay, in the same fashion that you would appeal your Part B premiums. Okay, so please keep that in mind. All right, that you do have that 60-day window in order to appeal these pricings. All right, when it because it could come out pretty costly at certain points. All right, so one of the biggest mistakes that people make is the initial enrollment period. That's the #1 mistake that people make. In order to enroll in Medicare, now everybody's eligible for Medicare on their birth month when they turn 65. So if you were born in September and you're going to be turning 65 in September, your Medicare eligibility will be September 1st of September 1st. That'll be not on your birth date exactly, September 1st, on the 1st of the month. Okay, so now you have a 7-month window in order to, or what's called the initial enrollment period, in order to apply for Medicare Part A and B. Okay, you can start as early as 3 months prior, which is June 1st. Okay, for a September 1st eligibility date. You can actually go up until August 1st or August 31st and apply for your Medicare, and you'll be able to get a September 1st. You won't have your cards, but you'll be able to get a September 1st eligibility date, so you can be covered. Okay, within that, once you get into that initial 3-month period. Okay, and you can go as much as December 31st and still enroll into Medicare, although you're not the eligibility date, even though you're not the eligibility date, but the effective date is going to be past that. Okay, so if you file for Medicare within the first 3 months prior to your September 1st or your eligibility month, okay, you will be eligible for Medicare, or you will have coverage on your birth month, starting that first of that month. But if you decide to wait until the day, let's say it's September, now you're not going to be, it won't be effective until the following month. So you're looking into October. Okay, so it's 1 month after your eligibility month. If you go into November, not only are you waiting from September to on October, but now you got to wait 2 months past. So the eligibility won't probably be until January 1st. And if you go into December, now you have a 3-month window. So not only are you starting in December, but now you got to wait, what's that? January, February, March. So March 1st will be your effective date at that time. Okay. Now, some people go past this. They don't have credible coverage, credible insurance coverage, and they go past, let's say, their timing. And now all of a sudden they say, you know what, I need my coverage. I got to go get something. And it's April 1st. Let's just pick April 1st. All right. So now it's April 1st. You go in there and you're looking for your Medicare. You go to Social Security. You're asking for your Medicare, and they're going to tell you, since you're past your initial enrollment period, you have to come back on January 1st and reapply or apply for your Medicare at that point in time. Okay, mind you, this is April 1st now. So now what happens? You have to wait all the way the whole year up until January 1st. You go in, you apply, and that's, by the way, that enrollment period starts on January 1st to March 31st. That's why April 1st, you're out of luck. Okay. But now what happens? You go in there in January of the following year, you apply for your Medicare. You'll get your Medicare A and B, but it will not be effective until July 1st. All right. So you could be going 18 months, roughly 18 months without any kind of Social Security or Medicare coverage. All right. And if your credible coverage, if your employer coverage ended, yeah, you could be out of luck with that. Okay. So very important. It's the #1 mistake that people make, is not actually enrolling in Medicare when they're supposed to. Another thing that I like to mention, if you decide not to take your Medicare Part B when you're Medicare eligible, every year that you wait on getting that Part B because you just want to collect your Social Security and you don't want to pay for that Part B premium, well, the day you decide to pick that Part B up, then you're subject, and you didn't have credible coverage, you're subject to a 10% penalty. That 10% penalty is on your Part B premium, and it never goes away. That's something that stays with you for life. So now that $148.50 for that Part B premium, tack on, if it's 1 year, tack on 10%, so add another $14.80 to that. So now you're looking at $166, whatever it is. And if you've gone, several years past that, let's say 4 or 5 years, now you're looking at a 40 or 50% penalty. And again, it never goes away. And by the way, that applies also to the Part D premium. So that penalty, that 10% penalty, also applies to the Part D premium. All right, D as in drugs. Okay. Now, who pays first? All right, because there are certain situations where you don't need to pick up Medicare. If you like your employer's coverage, you're eligible for the employer's coverage, then you can keep that employer's coverage, and it will be considered credible coverage. Okay, but who pays first? Okay, let's say if yourself, or let's say you're Medicare eligible at age 65, you're on a group plan or your spouse's group plan, but your employer has less than 20 employees. Okay, you need to pick up Medicare because Medicare becomes the primary payer. All right, so Medicare will pay first in that situation. In the other scenario, if you're over 65, but you're on a group plan or your spouse's group plan, the employer has more than 20 employees, then you can keep that group health plan, and that will be considered credible coverage. So you're good. If you're disabled, and once again covered under a group plan or a spouse's group plan, and you pick up Medicare, if your employer has less than 100 employees, then Medicare will be the primary payer. And this time, if you're on over 100 employees on that disability, then you can keep that group health plan, and that'll be considered the credible coverage. Okay, so if you're disabled and your employer has over 100, you can keep the group health plan. Okay, if you're on a retirement plan, any kind of employer retirement plan, and you are entitled to Medicare, you become Medicare eligible, they are going to want you to take the Medicare. Medicare is going to pay first. because what's going to happen is that they're going to let Medicare pay whatever it is, and then they'll pick up the balance. All right, so be very careful with that. Don't think that whatever you have, once you're Medicare eligible, if you're, oh, I'm on my retirement plan. No, you really need to see what exactly is that they're going to be covering, and they're going to want you to pick up Medicare. Okay. Now, this is the tricky one, COBRA. Okay. Excuse me, COBRA. Everybody, our pre-65 mindset is that if you have COBRA, it's an extension of your coverage, okay, to your employer, which is true prior to Medicare eligibility. Once you become Medicare eligible, Medicare is primary. COBRA is not primary. It is not the same. You will have to pick up Medicare. There are people that, you know, have that pre-65 mindset or that pre-Medicare eligibility mindset, and they turn around and say, well, no, I have my COBRA, so I don't need to pick up Medicare. That's fine. I'll pick it up later on. And then all of a sudden something happens. You end up in the hospital, and guess what? That COBRA account's going to say, no, I'm sorry, you got to submit that to Medicare, but you don't have Medicare. So guess what? You're going to foot that bill. That's called the COBRA trap. I didn't make that up. It's called the COBRA trap. So as you can see, a lot of people fall into it. So please be very careful with that. Okay. Now, Part B enrollment scenarios. Okay. Now remember, your Part A, where you'll be automatically you'll be Medicare eligible for your Part A at turning 65. Do you need to get it? Not really. You can get it if you want. It doesn't really matter. You're not paying for it. It's fine. Okay. If you want to get it and submit it, if you go into a hospital, you could do that, and then whatever the balance into your doctor or your group coverage or whatever the case is. But in order for your Part B, if you were turning 65 and you were already collecting your Social Security benefits, then you will be automatically enrolled in Parts A and Parts B. Okay, so very important. If you are collecting your Social Security and you're auto-enrolled in A and B, but you are taking credible coverage, your employer is more than 20 employees, and you want to keep that credible coverage, you need to disenroll from the B. Okay, and the reason you need to disenroll from the B is because once you get that B, you have a 6-month open window in order to pick up any plan you want, whether it's a Medigap plan or an Advantage plan. To pick up at that point. If you're sick or something and you might not be able to get a Medigap plan, if you are if you're looking for a Medicare Advantage plan, then you'd have to wait till October 15th to December 7th in order to enroll in a Medicare Advantage plan, and then now you're looking at up to January 1st from when the plan starts. So if you're turning 65, you're auto-enrolled in Social Security, you're on a group plan, return that Part B. You do not want to keep that Part B. First of all, you're going to pay for something you don't need. So that right there is like, just get rid of it, return it, okay? Now, if you're turning 65, you're not enrolled in Social Security, you'd like to enroll in Social Security, that's the website that you can go in. It takes about 10 or 15 minutes to do. It's a very simple process. And once you submit that, they might ask you further questions, but generally they'll just enroll you and send you your Part B. Okay, and remember the initial enrollment period. It's all part of this. Okay. Now the next scenario: enrolling after the age of 65, after your Medicare eligibility, and you have had credible coverage, and now you're 69 and you're deciding to retire. Then you're going to need what's called the CMS forms, or the Centers for Medicare and Medicaid Services forms. Okay, this is what those forms look like. This is after enrolling after the age of 65 or your Medicare eligibility, and you have had credible coverage through an employer. Okay, the form on the right, the form on the left-hand side, which is the CMS 40BE. That is the one that you fill out yourself, informing Medicare of when you would like to get your Social Security or your Medicare A and B started, okay? And then, or your B, because the A is already started on your birth month. It's the B that this is concerning. The other form, the L564E, which is on the right-hand side, That's the one that gets printed out or filled out by your employer. That form tells Social Security that you have had credible coverage from whatever day it is to whatever day they're going to continue to have you on, and whatever day you're going to look to retire. Okay. Now, what does that form do? How important is this form? This is the one that knocks that 10% penalty off. All right. So if you continue to work past the age of 65 and you had credible coverage, again, remember, if you didn't have credible coverage, it's a 10% penalty. These two forms right here will take care of that, and it'll inform Medicare that you had credible coverage, and you will not be penalized. Okay. How would you do this? I generally tell my clients, once you're gonna start to retire, you know when you want to retire. Try and do it 3 months prior. You can do it up until the day before you retire, but are you going to have your cards? No. Okay, everything's got to go through. And if something happens and the forms get lost or whatever the case is, you could have an issue. You could go without coverage. I always tell my folks, you can do it 3 months prior. Do it as soon as you know you're going to be retiring. So if you're planning on retiring in October, your employer is going to take you to the end of October with their coverage. So you want Medicare to start you on November 1st. Okay. Another thing about these forms, please, 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 please once you get these forms filled out, make copies. I always suggest that you can walk it. With COVID now, you have to send it within the mail. So the chances of these things getting lost, it's pretty high. I've had situations where I've given my clients the forms, and they've said, okay, here's make sure, by the way, it's one form for each person. Okay. They've walked right into Social Security pre-COVID and handed the forms to the clerks. 3 weeks later, one spouse gets their Medicare ID card, the second one doesn't. When they inquire about it, they never got the form. You handed it in at the same exact time. What happens? God only knows. But make copies. Make sure you keep the copies. Send it in. Now we have to depend on the mail. Send it in the mail and get your, and keep your fingers crossed. Bottom line. Okay. If you need these forms, I do have them available. I can pick them up for you. I can email them to you, send them to you, whatever the case is. And by the way, I also do have the disenrollment form in case you want to, you got your Medicare eligibility for A or B, and they auto enroll you and you want to disenroll. I can take care of that for you. I can send you the form. All right. Now, Medicare Choices. What do? You get your Medicare. Medicare only covers certain percentages of pricing. What do? Do I go into original Medicare, or do I take a Medicare Advantage plan? Okay. I will get in depth into the Medicare supplement plans or the Medigap plans. I will get in depth in that. I cannot get in depth into Medicare. I cannot show you a Medicare Advantage product or an actual product. All right, because that's against guidelines. I can tell you what they do have and what they don't have. Okay, and it's easier with the Advantage. So I'm going to start with the Advantage. As I mentioned before, the Part C or Medicare Advantage it's an HMO or a PPO. Okay, HMO, you're basically in the network. You're not going anywhere outside that network. If you are away and you get sick and you do get into into an emergency room scenario, they will take care of you. That will be covered. They will take care of, they will set you up and then send you to your coverage zone. Okay. As I mentioned before, generally a lot of times these things might just be a county-wide where the plans are set up. It could be statewide. Okay. Now, what do? Since you're within the realm of the doctors or the privatized plan themselves, okay, the Medicare Advantage does have to give you exactly the same thing that a Medicare, the Part A and the Part B or original Medicare gives you. So they have to give you the same exact thing as A, and B, okay? In some cases, they will include the D. In most cases, they usually include the Part D, all right, which is your drug plan. And, you know, again, the hospital and the doctors will be covered. But you do have higher deductible plans or deductible with these plans, out-of-pocket costs. It's as much as $7,600 in 2021. So you can potentially go to, you know, within a hospital, you can spend, you know, or any kind of hospitalization, you can spend $7,600 this year. If you have a PPO, which allows you to go outside of the network, but you're at a higher deductible at higher rates, it's a little over, it's about over $10,000. I'm not exactly sure the exact figure, but it's over $10,000 that your out-of-pocket cost can be. Okay. In some of these plans, if you go into the hospital for one day, they might charge you one day. They'll charge you $700-800. You would have to come out of your pocket. In most cases, let's say they'll do like the first 3 days, you're going to spend $500 per day. I've seen scenarios where the first 5 days you're going to spend $300 or $400. You know, with the first 5 days in the hospital and doing hospital. So basically you're going to be spending, you know, you're going to roughly be spending about $1,400-1,500 every time you go in with a Part C to go into the hospital. Do they have, as far as CAT scans, any kind of testing that they do have out-of-pocket expensive co-pays that you would have to deal with those things, with that scenario. So, you know, it's to me that's what a Part C is. It's an HMO or a PPO, and you do have an added expense. Now, as far as this goes, let's say, for instance, you know, God forbid, you know, you come up with a cancer or something, okay, and if it's in November, you're going to hit that $7,600 mark right away. Okay, right away you're going to hit the $7,600 mark with the chemotherapy and everything else. So now if it's in November, now you go into January, okay, well, that deductible reloads at that point. So now you go for a second or a third round of chemotherapy. Now you're looking at an additional $7,600 at that point. So within a 3-month span, you're looking at over a $14,000 hit to your pocket, okay, with those Medicare Advantage plans. I will show you what the out-of-pocket is for a Medicare, original Medicare with a Medicare supplement plan. Okay, but basically, folks, this is the 2 ways that you can go. You could either take a Medicare Advantage, or you could take original Medicare. Now, Medicare Advantages, as I mentioned earlier, it's 0 premium in most cases, although in some cases you do pay. Original Medicare. Oh, by the way, you still have to pay your Part B, even if you took a Medicare Advantage plan. Okay, your Part B is it's gonna be deducted from your Social Security benefit. Whereas with original Medicare, same exact thing, but you do have a monthly cost with a Medigap plan. So let's just break that down real quick. Original Medicare is a comparison to a Medicare Advantage. Now, this is the number 3 mistake. I have not missed the 2. Okay, this is the number 3 mistake. And then to us, it's been people don't analyze their product correctly or what they want to do. All right. So which way do I want to go? You really should find out the facts of everything, see what is the best option for yourself. And by the way, it's for you. What's good for you might not be good for the next person or your spouse or the third person or the fourth person. Okay, Medicare is very individualized. So what's good for you might not be good for anybody else. Okay, so you have to look for yourself and see what the advantage is. Okay. And another thing, if, like, for instance, you decide not to go into a Medigap plan at some point, and you do pass that 6-month open enrollment period with your from the effective date of your Part B, then after that, you will have to go through medical underwriting. And if you have certain diseases, you're not going to get a Medigap plan. All right, and I'll show you the pricing in a little bit as far as what Medicare covers and how the difference in pricing is. Okay, so the relationships or the characteristics. Now, the relationship to a Medicare Parts A and B, Medicare Advantage plan or the Part C replaces original Medicare A and B. Whereas with original Medicare and a supplement plan, the supplement plan that literally supplements Medicare. Okay. Is there a private network required? In most plans, yes. In the Medicare Advantage world, that definitely is. Original Medicare, no. There is no private network. You can go to any doctor or any hospital. And as I mentioned earlier, 98% of the hospitals take Medicare, 95% of the doctors take Medicare, okay? Referrals are required in some cases with the Medicare Advantage plans. It is not required with a Medicare supplement or original Medicare with a supplement plan. You can go any doctor at any time that you want, wherever you want to go. Is your Part D included? As I mentioned a little bit earlier, most plans, yes, it is included in the Part C. It is not included in original Medicare. You would have to pay for that separately. The monthly premiums vary by plans. It is generally lower with a Medicare Advantage, as some plans actually cost you $0. Most plans actually cost you $0. So it is generally lower as far as your monthly premium. And with original Medicare and a Medicare supplement, it's definitely a little bit higher. And they do vary in pricing, and it varies from insurer to insurer also, okay? Annual out-of-pocket costs, this is actually an old slide. It's $7,600 now. Whereas the out-of-pocket expense for original Medicare with a supplement is actually very minimal, okay? Are the plans guaranteed renewable for life? No, it is not with a Medicare Advantage plan. Every year between October 15th and December 7th, you should look, if you do have a Part C or an Advantage plan, you should look, see if your plan, any plan changes in that plan itself. Is the plan still available within your work area? Is there another plan that might be better for you? You know, you do have to research it between during your open enrollment period or your annual enrollment, your annual enrollment period at that time. Okay, RX plans also you should do, but we'll talk about that later. A lot of times you can walk away. Let me skip that. Original Medicare with a Medicare supplement, yes, it's guaranteed renewable for life. You're never going to lose a plan. The only way you can lose a Medicare or original Medicare with supplement plan is if you do not make the payment. That's the only way you can lose a plan. Okay. So I'm going to go into the different plans, Medicare Advantage plans, because Medicare supplement plans. As I told you earlier, it's a lot easier to work with a Medicare supplement plan, and it's more, it's the illustrations are better, and this will actually give you an idea of what Medicare actually pays, okay, versus what an Advantage plan that it doesn't pay, okay. The three major plans on the market, it's Plan F, Plan G, and Plan N. Okay, there are other plans out there, but in some cases they might cover less, they might be more expensive, and they're not really worth it. So the three main plans that that we stay in contact with is the Plan F, the Plan G, and the Plan N. As you can see, we sold 7% of our policies in 2017 were only Plan Fs versus Plan G, which is 77% of our policies in that same year. Okay, and then we sold 8% of the Plan N. We sold 8% of those policies in that same year. Now, why is that? Plan F is a great product. It's a great plan. It covers 100% of everything. So you pay your monthly premium. That's all you need to pay. You go to the doctor, hospital, you show your cards, you're good to go. Not a dime comes out of pocket other than your monthly premium. Now, the Plan G has one thing that you would have to pay for out of pocket, and that's a Part B monthly, the Part B deductible, yearly deductible. And this year it's $203 or $204. So that's the only difference between a Plan G and a Plan F, is that the Plan G does not pay for that Part B deductible. Okay. But since Plan F is such a great plan, how come we only sold 7% of that? Because the pricing difference between a Plan G and a Plan F is so severe that you could spend $400, $500, $600 more on a yearly basis for a Plan F than a Plan G, and basically the only thing the F is doing is covering $200. So you're overspending for the F plan. Some people don't care; they'd rather spend the extra few bucks and not have to worry about anything. That's totally up to you. Our suggestion has always been the G plan. There's no sense in sending to some insurance company more money than you really have to. That's how I look at it. The Plan N, on the other hand, there's 3 different things that it does not cover. It does not cover, again, it does not cover that Part B deductible, yearly deductible. It does not, it has co-pays. So you would have to, you have co-pays of $20 for a hospitalization. So I'm sorry, $20 for doctors and specialists, and up to $50 for an emergency room. Okay, so that's what the Plan N doesn't cover. But why did we only sell 8% of that? You know, it should have been less, but it's only maybe $20 or $30 less compared, depending on which company you're choosing. Okay, so a lot of people say, you know what, I'd rather just spend the $20 and not have to worry about these other things. And I'll explain the excess charges in a few minutes, okay, as to why that one is really an important one for the Plan N, okay. Looking at the plans, I'm going to go over exactly what Medicare plans show and what Medicare plans, what Medicare covers, what the plan is going to cover, and more importantly, what you have to pay, okay. The Plan F is, I'm going to go over the Plan F, the Part A, all right, for a Plan F, because the Part A, or your hospitalization, remember that, your hospitalization is exactly the same in Part A, whether it's for the Plan F, Plan G, or Plan N. It's exactly the same. This formula that you're looking at is a G and an N are exactly the same. So I'm not going to be talking about those. You're just going to concentrate on Plan F. So now, you go to the hospital, the first day in the hospital, or 60 days in the hospital. So the first 60 days in the hospital, regardless of whatever length of time it is, you're going to spend $1,484 of that once you're in the hospital. Okay, so you stay overnight, $1,484 comes out of your pocket. All right. From day 61 to day 90, you still have to pay the $1,484, but now they're tacking on $371 a day because that's not covered by Medicare. Okay. After 91 days, Medicare gives you a 60-day lifetime reserve of days, which you can use. Okay. Once it's used up, you're done with that. But at that point in time, you're going to be additionally paying $742 for each one of those days on a daily basis. Okay. What happens with the Medicare Advantage? I'm sorry, the Medicare Supplement plan. It covers the $1,484 for the first day. It covers the $371 a month, and it covers the $742. I'm sorry, a day. Okay, so you will not spend a dime. As you can see on the green field, all costs in the hospital is basically paid by Medicare Part A. Okay. In addition, even though Medicare only gives you 91 days plus that 60 lifetime reserve day, a Medicare Advantage, if you see what plan pays, it pays for an additional 365 days, okay, of any Medicare eligible expenses will be paid by your Medicare Supplement plan. So you could be looking at this, you could be spending 515 days, God forbid, in a hospital. You will pay absolutely nothing with that plan. After that, after 515 days, then obviously you're on your own at that point. Skilled nursing facility care, or any kind of the skilled nursing facility, or maybe a hospital rehab plan, or any kind of rehab for that matter. The first 20 days is covered by Medicare 100%, but from day 21 to day 100, you're spending $185.50 on a daily basis. Okay, the Medigap plan does pay for that, and you don't pay anything for it. Okay, the blood, the first 3 pints of blood that you might need as some sort of transfusion, for whatever reason, Medicare does not pay the first 3 pints of blood. Okay, so that would be on your own, but with your Medigap plan, that's going to cover it. So the Medigap plan will cover the first 3 pints of blood. Okay. Any additional amounts that might be incurred in the hospital, it's 100% covered by, not 100% covered by Medicare. It is covered with the Medicare Advantage. I'm sorry, the Medigap plan, and it's not. You don't pay anything for it. Any hospice care is 100% covered, so you don't have to worry about that. Okay. So as I said before, the Plan F, the Part A, with a Plan F or G or an N, the Part A, you go into a hospital, you don't spend a dime. Okay. As I mentioned earlier, with a Medicare Advantage, that $1,484, even if you're not paying anything for your monthly premium, it doesn't matter. Generally, you're going to be spending about about $1,500 every time you go into the hospital with a Medicare Advantage, up until you satisfy the out-of-pocket, the maximum out-of-pocket. Okay. Plan F, Part B of Medicare. Medicare does have a $203 Part B deductible. All right, that will be that's paid under a Plan F, but that's the only one that's different from everything else. So as you can see here, even if you're outside the hospital, the Plan F, so original Medicare, where your Plan F Medigap plan is covering you 100% of everything. All right. Also, any kind of foreign travel. All right. Any kind of foreign travel. Medicare doesn't cover any foreign travel. The plan does give you a $50,000 lifetime reserve maximum. So what happens with that is you do have to pay a $250 deductible if you're on vacation and it's an emergency. You're on vacation, you break a leg, you break an arm, whatever it is. So you have the $50,000 maximum lifetime benefit. With that, there's a $250 deductible, and then you wind up paying the first or the 20%. The company picks up, or the Medigap plan picks up the other 80%. Okay, so if you're out of the country, you do have coverage. You can get sick or whatever the case is. I'm not talking about sniffles or a cough or something like that. No, I'm talking of a sickness. You can get coverage. I also, just because you have this, I encourage folks, if you're going to go on vacation, you have your original Medicare with a supplement plan, so you have a coverage. I still suggest you get yourself some sort of travel insurance, only because I had a situation where some lady had broken her leg out on vacation, and she broke it in such a way that she had a huge cast. She could not take a commercial airliner back. So Medicare took care of, or the Medigap plan took care of the the cast and everything else for her leg and the durable medical equipment and all that stuff, but she couldn't get on a commercial airline. So thank the Lord, she had picked up her travel insurance, and it was about $20,000-$25,000 ride for her to get back to the United States because of the injury. So, I suggest, yes, you do have coverage through your Medicare supplement, or your Medicare supplement plan or your Medigap plan. But if you're going to go on vacation, don't hesitate to get that additional coverage. It's pretty cheap too. Okay. So as I mentioned before, what is the difference between a Plan F and a Plan G? The only difference is that, other than the monthly premium, which is a lot less on a Plan G than an F, is that you would have to wind up spending $203 at the very beginning of the year. Now, that's whether you go for your doctor's appointment the very first time, or he sends you to any kind of specialist, or any kind of procedure. The very first $203 that you're gonna, in the beginning of the year, with your Part B your Part B is going to be you're going to wind up paying out of pocket. After that, it becomes a Plan F. So is a Plan F necessary to get? No. And by the way, Plan F, as of January 1st of 2020 of last year, if you were newly eligible to Medicare, on January 1st of 2020 or after, you cannot pick up a Plan F. If you were eligible for Medicare prior to January 1st of 2020, you can still pick up the F plan if you so desire. Okay. What's the difference between the G and the N now? As I mentioned before, the N, you still have the $203 deductible. You have a $20 copay for up to $20 for doctor visits and specialist visits, and up to $50 for an emergency room visit. If you stay overnight, then you don't have to pay. You don't have to pay, because now that becomes under the Part A of medical. Okay. Now, the Part B excess charges, I have mentioned about that. There's the three things that's the third item that is not covered by a Plan N. The Part B excess charges is 15% of any of an above approved Medicare amount is not covered by Medicare or by the Plan N. All right. So let's say, for instance, you go to the doctor's $250 and the Medicare comes back and says, I'm sorry, we're only paying you $200. The 15% the differential of 15% could be tacked onto you, could be sent to you. And that's why a lot of folks would rather opt to pay another $20 or $30 for the Plan G and not have to worry about that Part B excess charge. Okay. Granted, a lot of doctors do not cover it or do not charge their clients. As a lot of people that I know that have the Plan N have no idea what I was even talking about. That's because the doctors will just take whatever Medicare gives them and they'll be happy with that. But the possibility is there if you own a Plan N. Okay. Medigap open enrollment. You have a 6-month open enrollment in order to apply for a Medigap plan with no questions asked. I had a gentleman with liver cancer, which out of the 6-month period was never, ever gotten a Medigap plan. But within that 6-month period, he was able to pick it up and it worked out for him very well. But you have a 6-month open enrollment period from the effective date of your Part B. So if your Part B becomes effective on September 1st, you have a 6-month open window in order to get any Advantage product, any Medigap plan or an Advantage plan also, with no questions asked. You'll be automatically enrolled in the plan. Okay. If you were on disability prior to 65, you do have an open enrollment once your Part B becomes effective, whenever that was, prior to the age 65. But now that you turn 65, they give you an additional 6-month open enrollment period when you turn 65. So what happened was the Part C was the Social Security disability plan that you can get. That was a little on the pricier side with the Medigap plan, but now people turn 65, they can re-enroll in another Medigap plan and see what's cheaper for them, what's going to be less expensive. Mind you, as far as Medigap plans go, it is a federal and a state regulated program. So whatever every single insurance company has to, or every insurance that offers a plan, FG or N, or a Medigap plan, has to abide by these same exact rules. The only difference is the pricing. Some companies will charge you, a 65 female could be $130, and I've seen as much as $170, $180 payment for the same exact coverage. It's just not worth paying all that. I do recommend A-rated companies, that's for sure, in order to pick that up. But if they're going to cover the exact same thing, take the least expensive A-rated companies. There's no reason not to. And we'll also see what else they might offer. Okay. Like I said, every single plan F, Plan G, or Plan N, no matter which carrier you choose or you have, has to do the exact same thing. And remember this is critical. Medicare is primary. Okay. When you go to see a doctor or you go to a hospital, Medicare is the primary, not your Medicare, your Medigap plan, not Aetna or not United Healthcare. No, it's Medicare. Whatever Medicare says we are paying, that Medigap plan has to go along with it, regardless of who it's for. Okay. We have some misinformation that I've dealt with a few times, where some people you go to a doctor's office and the people behind the scenes like, oh no, we don't take that Medigap plan. Oh yes, you do, because you take Medicare. Okay. And you don't even have to deal with it. Medigap, the Medicare is going to actually pay whatever it is, and they'll notify the Medigap plan, so they don't even have to basically deal with it. All right. So I had situations where people are like, well, no, we don't take Aetna, we don't take United Healthcare on the plan. No, you do. You take Medicare. Medicare is primary. Remember that. Okay. If, for instance, something happens and you can't get in, you need some sort of guaranteed issue plan. There's different scenarios that you can actually get into a Medigap plan. Okay, so it's not like you're totally out of luck if you're past a 6-month open window. But there's different scenarios. Let's say you have original Medicare and you're on employer's group health plan, including COBRA or retiree or union coverage, and that plan is now ending. Okay, you have a 63-day window, calendar days, in order to apply for any plan. If you were born January 1st, prior to January 1st of 2020, excuse me, if you had your Medicare eligible prior to January 1st of 2020, then your guaranteed issue plan B will be a plan F. Anybody after January 1st or January 1st and thereafter of 2020, your guaranteed issue plan will be a plan G. Okay. So you have a 63-day window in order to apply for a guaranteed plan. The next scenario is if you had a Medicare Advantage plan and your plan is leaving. These plans could pack up and leave the your coverage zone at any time that they want. Okay, that's another reason. That's the not guaranteed renewable portion of it. So if they could be in a, you know, in an area, then all of a sudden, you know, we don't want to continue that coverage there. So you can either you have a 60-day window prior to the loss, or 63 days afterwards, or 63 calendar days afterwards, in order to apply for another coverage. Again, under guaranteed issue rules. You had a trial right. Okay, so you join the Medicare Advantage plan, and you decide you don't really like it. Okay, within the first year of joining that plan, you can switch to original Medicare, but it's, again, it'll be under guaranteed issue rules. Okay, and once again, if you're looking at it 60 days prior to the plan ending and 63 days after the plan ends in order for enrollment. Let's say you decided to drop the Medigap plan. You don't want to, you know, pay the extra money, whatever the case is, and you decide to go to a Medicare Advantage, and then after a little while, you figure that no, that I don't like this at all. It's too much money out of pocket. You, again, 60 days prior and 63 days after, the 63 calendar days after, you can apply for guaranteed issue. If your Medigap insurance company goes bankrupt, all right, if nobody picks it up, then you, once again, 63 days after the calendar days, you can pick up a guaranteed issue plan. If you had a Medicare Advantage plan or even a Medigap policy, and or they duped you into believing, well, you know, that you were supposed to get, you were just plain out misled into accepting the plan. You have a 63-day calendar window once you can prove that happened. 63-day window in order to apply for any kind of another plan. Okay, so you do have some protection in case something happens. It's not like all of a sudden you got sick, you're out of your Medigap plan, and you can't get back in. You know, no, you do have some sort of, you know, you do have some help that you can get a guaranteed issue plan. Okay. So that concludes the Medicare Advantage and the Medicare supplement issue part of it. And now we're going to go into what's called the Part D, or the prescription coverage. Okay. This is the fun part. This is the fun one. This is the one that's actually pretty dicey. So these are actually 2020's pricing. It's $445 for this year as far as the deductible goes. As I mentioned before, all Part D plans, or it's run by individual plan RX plans, so they have to abide by certain rules set up by CMS, state and local government. Okay, so every plan has to, if you're going to do a Part D plan, they all have to abide by certain rules. The certain rules is that you have to have you have to have a top of your annual deductible. You have to have a top on your when you hit the initial coverage, a top on your coverage gap, and when you end up inside the donut hole, and the top on when you come out of the donut hole. Again, these are the pricing. These pricings are just a few dollars more, as these are for the 2020 pricing. But once you hit a deductible, okay, once you go into your RX plan, and it's very important to pick the correct RX plan. You will pick up a RX plan between October 15th to December 7th, and it will be effective on January 1st. It is critical that you look at your prescription drug coverage every single year. I do it for my clients every year. I send them the list of medications that they had given me. I ask them to update it, and then I rerun the formulas for me, the formularies for them, and let them know whether their plan is still good or should they switch to another plan. So even if your medications don't change, the plans do change. So you know it's something you should be, you should definitely look into it. And if you pick the wrong plan, as I'll show you in a couple of minutes, you can wind up spending thousands and thousands of unnecessary dollars. All right, so it's very critical that you check your RX plans every single year. All right. What are some of the things that the plans have to give you that are federal and state regulated? They do have to have a top or a maximum as far as the annual deductible goes. Okay. Tiers 1 and tiers 2 medications are not subject to any kind of deductible. Tier 3, 4, and 5 is subject to a deductible. So once you have a medication that's a tier 3, a 4, or a 5, you will be paying that $445 when you first get to the, as long as if the pricing of that medication is above that, you will be paying the $445 deductible. Okay, so it's going to come right away, come out of your pocket, and that's the deductible phase, or the step 1. Okay, the initial coverage gap. Now it's right after the deductible period. Now the initial coverage gap, what it does is it's the retail cost of every single medication that you take. Once it reaches $4,020, it's a little bit more now, but once it reaches $4,020, okay, and that's the total retail value of all your medications. Once that reaches that point, that's when you fall into the donut hole. All right. So at this point in time, you're going into the pharmacy, and you have a $400 medication, and that $400 medication, you have a copay, maybe $20, $30. It's a tier 3 or tier 4 med, whatever the case is, and you're in the initial coverage zone, and you do have your copay. You're paying for that. But now all of a sudden you're out of the initial coverage, or the retail value of the meds are over the $4,020. Now you fall into what's called the coverage gap. At that point in time, all right, you're going to be paying 25% of the medication's price if it's a brand name, and 25% of a medication if it's a generic drug. Okay. So what happened to that $400 drug that you were just paying for a $20 or $30 copay? Well, now you got to pay 25% of it. So you're going to show up the following month, and the pharmacist is going to say, well, it's $100. All right. So that's how the donut hole works. Don't be alarmed. It doesn't happen to everybody. 14% of the people actually fall into the donut hole, and then like maybe half of that percentage comes out of the donut hole. What's the actual amount of money that you actually spending? Could be about $2,000, $2,500, in that ballpark to fall into the donut hole of your real out-of-pocket cost, and then as much as $6,300 and another $2,000 or so in order to get out of the donut hole or the coverage gap. And the way that's spaced is on what's called the true out-of-pocket cost. There's 3 different factors that is involved with this. One is what the pharmaceutical company is going to pay. They're going to pay 75% of that. What is the plan that you pick, what they're going to pay, and then your 25%. Okay. Once all that's combined, that's what's called the true out-of-pocket cost. So as you see, it's not you spending $6,350. It's all part of that equation. Once all those 3 equations reach the $6,350, you come out of the donut hole. You fall into what's called the catastrophic coverage at that point. Catastrophic coverage at that, now you're paying either 5% of the med, or $8.95 for a brand name, or $3.60 for a generic, whichever is greater. Okay. In order to do your Medicare, your RX plans, okay, we choose a company. We choose Medicare.gov. All right. The way the plans are suggested to you through Medicare.gov, there's 4 different ways. There's 4 different scenarios that they combine, and it looks into what it is. All right. So now, how much does the plan cost you on a monthly basis? What are your deductibles and copays for those medications? Okay. What is the what are the tiers, and how much are you going to be paying for or if it falls into any kind of category, or the tier 2, tier 3, or tier 4 of those drugs, whatever the case is. And then also it goes into obviously which plan, which Medicare pharmacy is going to be, or which pharmacy is actually the preferred provider. So once it takes those 4 items into consideration, What does it do? It takes the least expensive of all the plans, the one that costs the least expensive of all of those plans, and it tells you this is the right plan for you. Okay, and it's very, very individualized, because our medications are different. Your medication is different from mine, from the next person, from the third person, and so on down the line. So it's a very, very individualized program. And as I said before, you should definitely do this every single year, October 15th to December 7th. Rework your medications, because that same plan that you had the year before, that has been switched over by the by the insurer, and now that plan makes it's just totally different. Okay, so you can wind up spending more money than you did the year prior if you didn't do your homework or you didn't do your due diligence. Okay, I'm going to go over a scenario of a young man that came into our offices. This is an actual scenario of the man's drugs that he had. This is about 4 or 5 years ago. And the gentleman came in and he said, listen, he said, and as you can see, this is the number 2 mistake that people make, is not analyzing your Medicare RX plan or your RX card correctly. So this gentleman came in and he says he got his Medigap plan, and he says, listen, my buddy, my next door neighbor, has a $39 RX plan. The plan, he swears by it, says it's the greatest plan in the world. I want that plan, and it's only $39. So he said, we're gonna do our research and we'll see what happens. So we go into Medicare.gov, we list all of his medications, and as you can see, the full cost of his medications was $1,669. Okay. So in about 3 months, 4 months time, this man's going to hit the donut hole. So he's going to get out of, during the initial coverage, he's going to be paying $611 for all his medications. After he hits the donut hole, he's actually going to go up to $781 for during the donut hole period. And once he comes out of the donut hole, remember, it's only like a 5% or $8.70, etc. And the catastrophic coverage will be $88.78 for his on a monthly basis. Okay, so as you can see, Card A, which is the one that we recommend, has a monthly premium of $98.30. Has an annual deductible of 0. His total annual cost for all his medications combined, everything, is going to be $4,796. That's not the card he wanted. He wanted his buddy's $39 plan. Okay, so we showed him his buddy's $39 card. Well, here's a $39 card. As you can see in red, 3 of those medications are not covered by the plan. So if he would have unknowingly or unwittingly picked this plan on his own, he would have not paid the $4,800. He would have been spending $12,800 on a yearly basis for the plan. Okay, because those 3 medications were not on the particular formulary. Those 3 medications were not covered, so he would have had to pay full price for those medications every single month he went to pick them up. Okay, still had a 0 deductible, but it doesn't matter. This is the reason why we're saying you really must look into these plans every year. Okay, and just to show the young man that the plan was not had nothing to do with the pricing or the monthly premium, we showed him another $97 plan, Card C in this case. This one did have a $325 deductible, but still, it added a fourth medication, excuse me, that was not covered. So now, what's his total annual cost? $16,200. So as you see what I'm saying, that it's very, very critical in order to pick the correct plan every single year. Make sure you do your homework, Medicare.gov. As I said, I send my clients every year, I send them the medications list that they had given me the prior year. Is this correct? If they made any changes, make your changes, send it to me now. I go back, I look on Medicare.gov, I list all the drugs on it, and then I send them back, okay, you can keep your current plan or you can switch to this plan, and I tell them why, because it's going to be X amount of savings for you, okay, like that. And just to summarize that, Card A is $98.30, but it's $4,800 out of pocket. Card B, his buddy's plan, is $39, but it's $12,600 out of pocket. And then that Card C, which was a $97 monthly premium, you're looking at over $16,000 in planning. Okay, as you can see, that's pretty critical. Folks, this concludes the workshop. And just to go over some of the items that we're doing, some of the items that we talked about, as I mentioned, the number one problem with people, number one mistake that people make with Medicare is not enrolling in that Part B on time. Be critical of that initial enrollment period. It could cost you 10% on a penalty for a year, and it stays there for life. Be careful with the Cobra trap. Retiree plans are also something that you would have to look in. You're gonna have to get Medicare once you turn 65 and you're Medicare eligible. Okay, and look into the Social Security disability plans. Also, if you're on Social Security disability, you have that 6-month open window. Don't forget that once you turn 65. Okay. The number two mistake that people make is not analyzing your prescription drug plans correctly. It could cost you thousands of dollars, as you very well saw. There's 30 different drug cards in the market for each individual state. So picking the right one is critical. What do you need? You look at that formulary. The formulary is definitely key. All right, so that formulary, each company does it on their own. So it's critical that we use the right tools in order to find the right plan for you. And that right tool is Medicare.gov. And the annual enrollment is between October 15th and December 7th. And again, Medigap plan, you don't have to renew. Medicare Advantage plans, you do have to renew, or you should look into. And the RX plans, you should definitely look into between October 15th and December 7th for January 1st open season. Analyzing your Medicare Advantage versus a Medigap. Actually analyzing the plan that you're looking to get. Remember, as I said before, this could be the last plan that you get for the rest of your life. Don't make it the one that's going to be the bad one, whereas you could turn around and it could cost you thousands of dollars later on. You're healthy now. We don't know what tomorrow's going to bring. Okay, is it going to be networks? Is it going to be referrals? What's my maximum out-of-pocket expenses? What's the changes during the annual enrollment? Any extra benefits or the overall expenses on these plans? You really need to look into it and see. Choose wisely. Find out what's on the table, and that's what I like to do. I tell people, this is what's here, this is what's there. You choose what you want to do. What's going to be more beneficial for you? Okay. You be careful with with your retiree coverage. Okay. Look at your monthly premiums. Look at the co-pays and the co-insurances that are associated with these retiree coverage plans. A lot of times, you think you got a good plan, you got something good going with your retiree plan, but if you have a $5,000 or $6,000 or $7,000 deductible or copay, is it worth it when you can pick up a plan? You can pick up a plan for original Medicare with a Medigap plan, and it's only going to cost you what, $1,500–$1,600 a year, $2,000 a year, but yet you're paying $5,000–$6,000 with a monthly premium. Also, analyze it, compare all expenses, see what's going to be more beneficial for you. All right, those waning years, we're not making too much more money, so any money that we can save, let's do it. Okay. Another thing, if you currently have a Medigap plan now, you should look into other Medigap plans and see. Remember, a Medigap plan is a Medigap plan. It doesn't matter which company it is. Why would you want to spend, $300 for a Medigap plan when you can get the same exact plan for $150? It just doesn't make sense to do that. Okay. Remember, Medicare is primary. Okay. And the number 5 mistake that people make is listening to friends and family. All right. Friends and family, even though they do well and they have good intentions, you should really talk to somebody that knows what's going on and has all the information in front of them to give you the information so you can make the correct choice for yourself. Okay. Drug cards, all the advertising. Don't believe the advertising. Don't believe the hype on TV. Okay. It's exactly what it is, hype. Okay. It's to get you in there to sell you that product and nothing else. And then what do you get out of it? Not much. Okay. And then the association plans, be careful with that. The Medigap, well, that's the Medicare, the Advantage plans, they're not guaranteed renewable and all that. So if anybody has any questions, we'll field them now. Here's my information once more. If you want to take it down. Again, I don't charge anything for consultations or any advice. I am commission-based. What I do is I want to show you what is out there, it's what's best for you, and then you can decide on your own what you'd like to get from there. At that point in time, I will enroll you, and then I'll make my commission at that point. No cost to you. I will also overlook your plans periodically, and I will then definitely do the RX plans every year, which is a very critical component to Medicare. All right, folks. Thank you very much. I really appreciate it. You guys listening in. If you have any questions, I do say one thing. If you have any very personal questions, please be careful. You do have other people online that are listening to the same exact questions you might have. I would prefer you either give me a call or send me an email with your specific questions, and I'll deal with you folks on a one-to-one basis rather than than just blurting out whatever it is, whatever issues you might have, to the world. So with that being said, if anybody have any general questions, I'll be happy to field them.
All right. Well, thank you so much, Mike. So far in the chat, we do have a couple of questions.
Okay.
The first one, I think it's general. It starts a little specific, but it gets general. So Kathy asks, my husband was in disability and it coverage to Medicare at age 65. He is now age 68. Does he qualify for any additional coverage and prescription?
Okay. Any additional coverage as far as a Medicare supplement plan? No, he had the 6-month open enrollment at age 65 in order to reapply for another plan. At this point in time, he won't be able to, but that does depend on what issue he might have. If it's something that it's not critical, and he might be able to pick up a Medigap Advantage plan. Medigap plan. And depending again on what issue he might have, there are certain Advantage plans out there for special needs. The special needs plans that you can also look into and possibly enroll. Some of those special needs plans do cover everything, so it's a lot better. But we're talking about end-stage renal disease, maybe a diabetic, or something like that. So it's something that we would have to look into in depth, and then I can get you a better answer. So yes and no. There are certain things out there, but it all depends on what the situation is. It's something that we'd have to look into.
All right. And then Donna asks, can you tell us specifically where on Medicare.gov you enter your medications?
Once you go on Medicare.gov, there's an area there, so you can just go in. It says log in without or continue without logging in, and it's going to come up a little slightly lower down on the page. It'll ask you where the what you'd like to do, and you can just pick up. You're looking for plans. Looking for plans. You click on that, and then it'll say you're looking for Medicare plan, Medigap plan, or RX plan. Click on RX plan, and then at that point you'll be listing. Do you get any additional coverage? The answer is no. If you don't get any other coverage, and you can just continue with the prompts, and it'll set you right up. All you have to do at that point, just type in whatever medication it is, the dosage, how many times, how many pills per month you get at the pharmacy, and you just continue, and then it'll pop up. Put down your favorite pharmacy, and then it'll tell you which is the best plan for you. Or just give me a call. I'll do it for you in no time. No problem.
All right. And so far, last question that I have so far is from Laura. She asks, does coverage from the VA impact Medicare coverage in any way?
VA coverage is generally great coverage. They basically take care of everything else. No, you will get your Medicare A and B, but they generally do cover everything else for you. That's something that you should look into, in particular through the VA themselves. But from my understanding with the VA is that once you have VA, you go to them, you're basically not paying a dime for anything other than after your Medicare. So it's great coverage. It's good coverage, but you should look into it and to let them know specifically what you get.
All righty, and I think that's about it for tonight. And it's already 8:30. Wow. So I think that's a good place to wrap it up for tonight. Thank you so much, Mike, for coming and speaking to the library. We appreciate this information that you've given us. Thank you for allowing us to record the presentation as well. Everyone who registered, I will be sending out a link to the presentation. It's also just going to be available on our YouTube page. And if you send me the presentation, Mike, I'll also send that out to everyone who registered as well. But that's up.
Sounds good. I will definitely get that out to you. And Naja, thank you so very much. It's a pleasure dealing with the Woodbridge Public Library. You guys are awesome, and putting these types of scenarios out to people that really don't understand what's going on or have a tough time understanding what's going on. It's a great help. It really is. So, and it's a money saver for people too.
Of course, we're just trying to, get everyone connected to the right information so everyone's life can be slightly less difficult.
Exactly. Let's try for that. Folks, thank you very much. There's my information. Give me a call. Send me an email. I'll be more than happy to help out or assist in any way. Remember, fees is there's no fees for I don't charge fees.
Awesome.
All right.
And everyone have a good night and enjoy what's left of the day. It's still beautiful outside.
Have a great night. Thank you, everybody.